Coronavirus outbreak: all the secrets revealed about the COVID-19 pandemic. A complete rational guide of its evolution, expansion, symptoms and first defense. Written by Sydney Osler. Copyright 2019 by Sydney Osler. All rights reserved. This document is geared towards providing exact and reliable information with regards to the topic and issue covered. The publication is sold with the idea that the publisher is not required to render accounting, officially permitted, or otherwise, qualified services. If advice is necessary, legal or professional, a practiced individual in the profession should be ordered. From a declaration of principles which was accepted and approved equally by a committee of the American Bar Association and a committee of publishers and associations. In no way is it legal to reproduce, duplicate, or transmit any part of this document in either electronic means or in printed format. Recording of this publication is strictly prohibited, and any storage of this document is not allowed unless with written permission from the publisher. All rights reserved. The information provided herein is stated to be truthful and consistent, in that any liability, in terms of inattention or otherwise, by any usage or abuse of any policies, processes, or directions contained within is the solitary and utter responsibility of the recipient reader. Under no circumstances will any legal responsibility or blame be held against the publisher for any reparation, damages, or monetary loss due to the information herein, either directly or indirectly. Respective authors own all copyrights not held by the publisher. The information herein is offered for informational purposes solely, and is universal as so. The presentation of the information is without contract or any type of guarantee assurance. The trademarks that are used are without any consent, and the publication of the trademark is without permission or backing by the trademark owner. All trademarks and brands within this book are for clarifying purposes only and are owned by the owners themselves, not affiliated with this document. Table of Contents. Introduction. Wuhan Epidemic Chapter 1. Human Coronavirus Outbreak 2020 Chapter 2. Coronavirus, SARS Chapter 3. Evolution and Identification Chapter 4. Reported cases all over the world. Chapter 5. OMS Global Health Emergency. Chapter 6. Preventive Measures by Countries. Chapter 7. Guideline for Prevention, Hygiene and Cleaning. The First Defense. Conclusion. Introduction. Wuhan EPIDEMY. According to most of the world's leading transmittable disease experts, the Wuhan coronavirus spreading from China is now likely to develop into a pandemic that circles the globe. Its prospect is really overwhelming. A pandemic, a spreading outbreak on two or more continents, may well have global consequences, with China and other countries, including the United States, which are now enforcing unprecedented travel restrictions and quarantines. Yet scientists still don't know how lethal the new coronavirus is, so there's concern about how much harm the pandemic might do. There is, however, growing consensus that the pathogen is being readily transmitted among humans. The Wuhan coronavirus acts more like the highly transmissible influenza than scientists have found in its slow-moving viral relatives, SARS and MERS. The number of laboratory-confirmed cases has risen over the last 3 weeks from about 50 in China to over 17,000 in at least 23 countries. There have been more than 360 deaths. Yet specific epidemiological models predict the total number of cases to be 100,000, or even more. While that growth isn't as quick as flu or measles, it's a huge leap beyond what virologists saw when SARS and MERS came up. Researchers are yet to say who is at the highest risk of developing serious or life-threatening disease, and what factors may protect against the disease. Kids are far less likely than middle-aged and older men to develop severe illnesses. Most of these foreign nationals who have lately visited China are barring entry through the United States. Americans who return from Wuhan and the epicenter of the outbreak, Hubei province, are to be quarantined for 2 weeks. Federal health officials warn Americans not to fly to China anyway. This is a very critical public health problem, and proactive action to protect the public has been and will continue to be taken by the CDC and federal government. However, there are only a handful of cases in the US and the risk to the Americans is low for now. Here's what people have learned about the virus and the outbreak so far. Chapter 1. Human Coronavirus Outbreak 2020. As 2019 drew to a close, reports emerged from an outbreak of unexplained etiology pneumonia, with cases clustered around Wuhan's Wuhan seafood wholesale market, China, that sold live fish, poultry, and birds. The cases were observed as of December 8 and the cluster was first identified on December 31. The market was being shut down on the 1st of January 2020, and on the 7th of January a new type of coronavirus was officially detected by the Chinese authorities. All suspect cases found were checked by active case finding and retrospective examination. Around 300 cases in Wuhan were believed to have been infected with this new virus, and 4 died. It is also suspected that previous outbreaks of similar diseases, including SARS, have arisen from live animal markets. Camels transmit the coronavirus which causes MERS to humans. The animal that was the source of the latest coronavirus is still unknown, and the collapse of the meat market in Wuhan has made the matter almost impossible to investigate. Bats are considered a possible source, because many viruses, including coronaviruses, have adapted to coexist. Nevertheless, it is very likely that the virus was transmitted to an intermediate species from the bats, and then to humans. Wuhan, a strong virology center in China, was well placed to diagnose and tackle the outbreak. It has, however, brought China's disease preparedness to the test in a part of the world that still regularly remembers the 2003 extreme coronavirus outbreak of acute respiratory syndrome (SARS). The virus then spread from China to 25 other nations, infecting over 8,000 people and killing about 800 people before it was contained. In the present case, the pace at which the Chinese authorities announced the outbreak to the international community was commendable and shows that lessons from previous outbreaks have been learned. As the international community reacts to an outbreak of coronavirus-induced pneumonia in Wuhan, China, early and transparent data sharing essential to its protection is dependent on the trust that the data will not be used without proper attribution to those who created it. What is the human coronavirus, and how dangerous is it? Coronaviruses are a large virus family usually targeting the respiratory organ. The name is being derived from the Latin word corona, meaning crown, due to the spiky fringe which surrounds these viruses. Many species, such as bats, cats and birds, get sick. Just 7 are known to infect humans, like COVID-19, SARS, and MERS. SARS is believed to have developed in China from bats to civet cats to humans. MERS has spread from bats to camels into Middle East humans. No one knows where the COVID-19 came from. For now, livestock in Wuhan, China, a town of 11 million, are thought to have taken the jump late last year. But scholars still seek to understand their exact roots. As for the signs, in 10 and more than 30% of cases, 2 of the 7 coronaviruses that infect humans, SARS and MERS, can cause severe pneumonia, and even death. The others, though, show milder effects, like a common cold. Apparently, it's evident that COVID-19 will kill, but it's not clear how often or how it relates the fatality rate to SARS and MERS. Most patients now start with fever, cough, and shortness of breath, according to the Centers for Disease Control and Prevention. An early analysis, published in The Lancet, offered even greater detail. It has looked at a subset of the first 41 patients in Wuhan with confirmed COVID-19. Fever, cough, muscle pain, and exhaustion were the most common symptoms. Vomiting, nausea, and coughing up mucus, or blood, were less common. They all had CT scans of pneumonia and lung abnormalities. As for the severity of the disease, 13 people were taken to an ICU, where 6 died. By January 22, most patients had been discharged from the hospital, 68%. More recently, records have also been made of people with very mild symptoms, such as the cases in southern Germany. There is even evidence that events are asymptomatic. It's likely that COVID-19 can look more like flu than it does like SARS. That's because when they are first detected, infectious diseases usually seem more serious, because people appearing in hospitals tend to be the sickest. However, the new virus seems less dangerous than both SARS and MERS. How bad could the outbreak be? The novel coronavirus, similar to SARS, seems highly contagious. The size of an epidemic depends on how quickly and easily a virus is transmitted from one person to another. Although work has just started, scientists have estimated that without successful containment measures, every person with the new coronavirus could infect between 1.5 and 3.5 people elsewhere. This would make the virus nearly as infectious as SARS, another coronavirus that spread in China in 2003 and was contained after 8,098 people were sickened and 774 killed. Those respiratory viruses may move through the air, wrapped in tiny droplets formed when a sick person breathes, speaks, coughs, or sneezes. Some droplets fall within a few feet to the ground. This makes it harder for the virus to get, unlike viruses like measles, chickenpox and tuberculosis, which can fly through the air for 100 miles. Nevertheless, detecting is better than HIV or hepatitis, which only spreads by direct contact with an infected person's body fluids. If each individual infected with the new coronavirus contaminates 2 to 3 other people, this may be sufficient to sustain and intensify an epidemic if nothing is done to reduce it. Contrast that to a virus less infectious, like seasonal flu. Those with the flu appear, on average, to infect 1.3 other people. The difference may seem slight, but the result is a striking contrast. In the same situation, only about 45 people could be infected. The number of cases outside of China has so far been limited. Yet reports have occurred in several countries in recent days, including the United States, of citizens who have not visited China. In addition, in 2003, the number of cases within China far exceeded the rate of SARS cases. The actual number of cases is almost definitely much greater than the number officially confirmed by laboratory tests. Thousands of people are suspected of having been infected in Hubei province, where the epidemic started, but have not been officially diagnosed. Doctors say there's a shortage of test kits and other medical supplies, and residents say it's almost difficult to get the health care they need to treat the coronavirus, or even diagnose it. Various epidemiological models predict the total number of cases to be 100,000, or more. Experts have urged caution when calculating these figures. How deadly is the virus? It is still hard to know. Perhaps the fatality rate is less than 3%, however, much fewer than SARS. This is one of the utmost significant factors, and one of the least known, in how destructive the outbreak will be. Assessing the lethality of a new virus is challenging. The worst cases are usually first identified, which may distort our perception of how patients are likely to die. Around 1/3 of Wuhan's first 41 patients had to be treated in an ICU, many with fever symptoms, serious cough, shortness of breath and pneumonia. But people with mild cases are never allowed to visit a doctor. There may be more deaths than we know therefore, and the death rate may be smaller than we initially thought. At the same time, there may be underreported deaths from the virus. The Chinese cities at the heart of the outbreak are facing a shortage of test kits and hospital beds, and many sick people could not see a doctor. There is still a lot of uncertainty about the existence of this virus and what it is doing. Early indications show that the fatality rate for this virus is significantly lower than that of another coronavirus, MERS, which kills about 35% of infected people, and SARS, which kills about 10%. All the diseases tend to bind on proteins on the lung cell surface, but MERS and SARS seem to be more harmful to lung tissue. Of China's 17,000 people infected, 82% had moderate infections, 15% had severe symptoms, and 3% were listed as critical. Lower than 2% had died from confirmed infections. Many of those that died were elderly men with underlying health issues. The virus causes serious respiratory disease, i.e., pneumonia, and death from mild symptoms. Many deaths occurred in people over the age of 65 and who were also suffering from another chronic condition or illness. Data suggest a case fatality rate of about 2%, meaning 2 deaths out of every 100 confirmed cases, even though it is still too early to give a reliable cipher. If the number of undiagnosed asymptomatic cases or cases with very mild symptoms turns out to be high, it could be lower. If the virus mutates, it could intensify. In any case, the fatality rate tends to be smaller than that of SARS 10% and higher than that of seasonal flu, less than 0.01%. Where has the virus spread? We still don't know how exactly COVID-19 spreads, but we do have a lot of data on how MERS, SARS, and other respiratory viruses travel from person to individual. In fact, this is primarily by exposure to droplets caused by sneezing or coughing. So when a sick individual coughs or sneezes, they let out a mist, and when those droplets touch another person's nose, eyes, or mouth, they will pass on the virus. In rare cases, a person can indirectly catch a respiratory illness by touching droplets on surfaces, and then touching mucosal membranes in the mouth, eyes, and nose. This is why hand washing is an important measure of public health, and particularly in an outbreak. The virus spread rapidly because it began in a transport hub. Wuhan is a hard place to get an outbreak in. It has 11 million people, more than the city of New York. On a typical day, 3,500 passengers take direct flights to towns in other countries from Wuhan. Those cities were among the first outside of China to record virus cases. Wuhan is also a major transportation center within China, linked by high-speed trains and domestic airlines to Beijing, Shanghai, and other major cities. Up to 2 million people flew from Wuhan to other places inside China in October and November last year. During the SARS outbreak in 2003, China had not been nearly as well associated. Large numbers of migrant workers are now moving domestically and internationally, to Africa, other parts of Asia and Latin America, where China's Belt and Road Initiative is making a huge infrastructure drive. This travel poses a high risk of outbreaks in countries with healthcare systems not equipped to handle them, such as Zimbabwe, which is facing a growing hunger and economic crisis. Furthermore, China has about 4 times as many passengers on the train and air as it did during the SARS outbreak. China took the unprecedented step of enforcing travel restrictions on tens of millions of people living in Wuhan and surrounding towns. Experts, however, cautioned that the lockout might have come too late, with restricted access to food and medication. Wuhan's mayor confirmed that 5 million people had left the city in the run-up to the Lunar New Year, before the restrictions began. The mode of transmission, the transmission mode, much of how COVID-19, a new coronavirus, spreads is unclear. Current awareness is based in large part on what is learned of related coronaviruses. Coronaviruses are a large family of viruses commonly found in many different animal species, including camels, goats, cats, and bats. Rarely can animal coronaviruses infect people, and then spread among people, including MERS, SARS, and now with COVID-19. Most respiratory viruses are spread by sneezing and coughing. Although the Chinese authorities initially played down the possibility of human-to-human transmission, substantial and sustained transmission among people has now become apparent. Chinese scientists have cautioned that some infected people may transmit the virus to others even before they develop illness or experience any symptoms, though a published study documenting asymptomatic transmission in Germany has been criticized as inaccurate. If the virus can be spread by individuals with no symptoms at all or mild symptoms due to respiratory disease, including headache or backache, that is terrible. They're up and about, going to work or the gym or religious services, and breathing on or touching other people when people don't know they're sick. Most often, the spreading from person to person happens within close contacts, about 6 feet. It is thought that spreading from person to person occurs primarily through respiratory droplets created when an infected person coughs or sneezes, similar to how influenza and other respiratory pathogens spread. Such droplets may land in nearby people's mouths or noses, or probably be inhaled into the lungs. Whether a person can get COVID-19 by touching a surface or object with the virus on it, and then touching their own mouth, nose, or probably eyes, is currently unclear. Usually, people are thought to be most infected with most respiratory viruses when they're most symptomatic, the sickest. It is important to note that the ease with which a virus spreads will vary from person to person. Many viruses, such as measles, are highly contagious, while other viruses are less so. There's much more to learn about the transmissibility, frequency, and other characteristics associated with COVID-19 and ongoing investigations. This information will help the risk assessment further. What symptoms should I look out for? Symptoms of this infection include fever, heavy cough and breathing difficulties or shortness of breath. The disease triggers pneumonia and lung lesions. Mild cases may mimic flu or a bad cold, making it difficult to identify. Patients might be familiar with other symptoms, such as gastrointestinal issues or diarrhea. It is known that the incubation period, the duration from exposure to the onset of symptoms, is anywhere from 10 days to 2 weeks. See your healthcare provider if you have a fever or cough and have recently visited China, or spent time with someone who did. Call first, so they can plan for your visit and take steps to prevent potential exposure to other patients and staff. How time-consuming does it take to reveal symptoms? The new coronavirus novel shows symptoms ranging from 2 to 14 days, enabling the disease to go undetected. Reported diseases have ranged from people with little to no symptoms to people who are severely sick and dying with reported COVID-19 infections. Symptoms may include fever, cough, shortness of breath. This is dependent on what was historically known as MERS virus incubation period. The amount of time it takes for signs to occur after an infected person can be critical for prevention and control. Identified as the duration of incubation, this time helps health officials to isolate or track individuals who may have been exposed to the virus. Nevertheless, if the incubation period is too long or too short, then it may be difficult to implement such steps. Many diseases, such as influenza, have a brief 2 to 3 day incubation period. Until they show flu symptoms, people can shed infectious virus particles, making it almost impossible to recognize and isolate people who have the virus. Nevertheless, SARS had an incubation period of about 5 days. It also took 4 to 5 days after symptoms started before the virus could be spread to sick people, which gave officials time to stop the infection and contain the outbreak effectively. Executives at the Centers for Disease Regulator and Prevention say the incubation period for the current coronavirus is 2 to 14 days. But whether a person can spread the virus before symptoms occur is still not clear, or whether the nature of the disease influences how quickly a patient can spread the virus. This is troubling because it may mean the identification of the infection will elude. Chapter 2. Coronavirus. SARS. In 2003, SARS first became known as a distinct coronavirus strain. The origin of the virus was never clear, although the first human infections can be traced back to Guangdong province in 2002. The virus then became a pandemic which caused more than 8,000 influenza-like disease infections in 26 countries with nearly 800 deaths. Unlike SARS, this new outbreak is caused by a coronavirus, a family of animal common viruses ranging from common cold to more serious diseases, such as respiratory syndrome in the Middle East MERS. The Wuhan coronavirus has caused fear all over the world, but memories of a deadly virus have also been brought up in Asia. There are 2 things in common between the coronavirus spreading in China and the 2003 SARS outbreak. Both belong to the coronavirus family and both were probably passed from animals to humans on a wet market. Coronaviruses are zoonotic diseases, which mean they spread from animals to humans. Since wet markets put people and live and dead animals, dogs, chickens, pigs, rats, civets, and more in close contact, making an interspecies leap can be easy for a virus. Poorly regulated live animal markets combined with illegal trade in animals offer a unique opportunity for viruses to spill over into the human population from wildlife hosts. Bats were the original hosts of SARS, and possibly this coronavirus outbreak too. Then, they infected other animals via their poop or saliva, and transmitted the virus to humans through the unwitting intermediaries. Bats and birds are considered pandemic potential reservoir species for viruses. At least 3 other pandemics, apart from SARS, have been traced back to bats in the last 45 years. The animals were the original source of Ebola, which since 1976 has killed 13,500 people in multiple outbreaks. Middle Eastern Respiratory Syndrome, better known as MERS, found in 28 countries, and Nipah virus, which has a fatality rate of 78%. To many, the current epidemic sounds eerily similar for 2003 when severe acute respiratory syndrome (SARS) spread across the country, infecting more than 8,000 people and killing 774. But whilst a similar virus triggers the Wuhan coronavirus and SARS, they are not exactly the same. Here's how the two line themselves up. The number of confirmed Wuhan coronavirus cases has outpaced the 2003 SARS outbreak within mainland China, as several countries evacuated their people from the region at the center of the outbreak. According to Chinese officials, there have been 6,061 confirmed cases of the virus in mainland China, including 132 deaths. As of Tuesday, the number of cases rose by about 1,500, an increase of more than 30%. The numbers do not include Hong Kong and Macau, both of which had a small number of cases registered. There were at least 91 reported cases of the virus outside mainland China, too. Nevertheless, there were 5,327 confirmed disease cases in mainland China during the 2003 SARS outbreak, with 349 deaths. Previously, experts suggested that the Wuhan virus statistics could still be widely underreported, rendering the novel coronavirus much more infectious, but also less lethal, than SARS. Chinese authorities have also confirmed a suspected case of the Wuhan virus in Tibet, which was previously the only place to prevent the virus. If confirmed, the spread to Tibet despite strict traveler checks and the closure of tourist sites will renew concerns about how easily the virus can be transmitted, especially when people are asymptomatic. Origin: both the outbreaks of SARS and Wuhan started in China, and both are thought to have originated from the wild animal markets. In China, scientists compared the Wuhan coronavirus genetic code to other coronaviruses and found it to be most similar to two samples of bat coronavirus. The animal species that caused it to spread to humans have not yet been verified by experts, but they have some guesses. Scientists believe that the coronavirus causing SARS emerged from a reservoir in bats, which then spread to the civet cat, a wild animal considered a delicacy in parts of southern China, then human. In the case of this new outbreak, it was traced to the now shuttered Wuhan seafood wholesale market in Wuhan, where a number of wild animals, including raccoon dogs and snakes, were for sale. Experts believe the coronavirus was carried by animals, likely snakes, and then transmitted to humans, perhaps from bats again. That's because further genetic analysis found that the snakes closely resemble the genetic building blocks of the Wuhan coronavirus. So the researchers believe a bat's population could have contaminated rats, which transmitted the virus to humans as they were being sold at the Wuhan wholesale seafood market. Amid SARS, China has banned civet cats from slaughter and consumption. China has gone a step further this time. The government announced it's banning all sales of wild animals across the world. Nonetheless, another study that contradicts the idea that the virus originated in the Wuhan wet market has recently been released. According to Science, which cited a report published in the Lancet Medical Journal, Chinese scientists found that the first reported case of the Wuhan coronavirus since December had no connection to the wet market. Moreover, 13 of the 41 cases they investigated for coronavirus had no connection to the Wuhan marketplace, the researchers said. The only way to be sure where the virus came from is to take samples of DNA from animals that were sold on that market and from wild snakes and bats in that area. Number of infections globally: more than 7,700 people have been infected since the first confirmed Wuhan coronavirus case in December. For contrast, between November 2002 and July 2003, there were 8,098 confirmed cases of SARS. It took fewer than 2 months to get infected over a span of 9 months, about 75% of the number diagnosed with SARS. In China, the number of confirmed Wuhan coronavirus cases has already surpassed that of SARS infected in 2002 and 2003. Since the outbreak of China's SARS 17 years ago, a lot has changed. But there are certain issues that have not. To date, at least 7,711 cases have been reported in mainland China, compared with 5,327 confirmed cases of SARS on the 16th of August 2003, the last time the Chinese Ministry of Health reported these results. Chinese local and international travel has risen intensely since 2003, which may help spread the disease more rapidly. The number of outbound visitors rose from 16.6 million trips in 2003 to 149.7 million in 2018, according to Chinese government estimates. It's worth noting that this outbreak occurred in China at the worst time of the year, Lunar New Year, when millions travel home to see their families. As of January 27, there were still 4,096 Wuhan tourists overseas, according to Wuhan's Culture and Tourism Office. Number of deaths: amount of deaths 774 people died during the 2003 SARS epidemic. In mainland China, and in Hong Kong, the vast majority of the deaths occurred. This time, the virus has infected 170 people, and so far, they were all in mainland China. Nonetheless, when assessing deaths, the best thing to look at is the case fatality rate, the indicator of what percentage of infected people end up dying. The case fatality rate for Wuhan virus is currently about 2%, significantly lower than the mortality rate of 9.6% for SARS. It is also lower than Middle East Respiratory Syndrome, MERS, another form of coronavirus, which has a 35% case fatality rate. But that estimate is only as good as the reported numbers. Some experts are worried that they may not have an accurate picture of the number infected in China, as test kits have been in short supply. Identifying the virus, recognizing the virus. One of the prime differences between SARS and this present outbreak is how rapidly it was announced and how easily it was detected by scientists. On the 31st of December, 2019, about 3 weeks after the first event was known, China told the World Health Organization about the new virus. On January 7, they identified the virus behind the outbreak. This is as rapid as any other advanced nation could have found it. Genome sequencing has a huge impact. It helps many countries to develop virus tests early on and to research the virus. After SARS, the disease was kept under wraps by China. The disease was first identified officially in February 2003, but by that time 5 people had died and 300 had fallen ill from the disease in Guangdong province of China. It was also not until 5 months after the first SARS outbreak began that American and Canadian scientists revealed that they had sequenced the genome that was believed to be the source of that virus. Health authorities had been struggling with a lack of knowledge about what the virus was back in 2003. And China has done things differently this time around. Beijing not only had the scientific ability to classify the genome, but it also taught other countries about it. Yet concerns also emerged about how open China has been. There are still some worried that the problem's size might be much worse than the official figures let on. Not all coronaviruses are fatal. Those that are unique to humans, including common cold, are often considered unreliable. Nevertheless, the coronaviruses which pose a pandemic risk are those which hang out in animals. Because these viruses didn't exist in humans before, there is no clear immunity in humans to these viruses. Chapter 3. Evolution and Identification. The new coronavirus that jumped at the end of last year from some animal to a person in the city of Wuhan has managed to attract huge attention from the media, scientists, and the international community in just a few weeks. The epidemic is developing very rapidly, and with it we have the knowledge of this new virus. The scientific community has managed to isolate it from not understanding anything at the beginning of 2020, sampling it, identifying it, and creating a diagnostic test. As with each new outbreak, however, there are many open questions that will be addressed as the disease progresses and as scientists continue to get a better grasp of the nature of the virus. In this episode, we will try to provide steady updates on the most important virus and epidemic information. The World Health Organization launched a strategic plan this week to respond to the novel coronavirus. It has declared an international public health emergency, as the first person in the US with a confirmed case of illness from the hospital went home. According to the World Health Organization, with more than 30,000 confirmed cases in China, the COVID-19 virus has killed more than 600 people, disrupted global travel and prompted governments and other organizations to take extreme measures to prevent its global spread, from evacuations to mass quarantines. It is not currently spreading beyond people in close touch with returning Wuhan travelers within the US, the Centers for Disease Control and Prevention said. Researchers are working to understand this new threat and warn current public health efforts, including the potential creation of a vaccine, including how the virus is evolving and moving from person to person. Infectious disease specialists at Fred Hutchinson Cancer Research Center, such as Dr. Trevor Bedford, are among the scientists at the front lines of that research effort. Bedford, a computational biologist who studies how viruses grow and spread, is gaining information about COVID-19 which he hopes will help save lives from this emerging respiratory virus disease. While he studied the spreading virus, Bedford shared what he has learned so far with the public through media interviews, the open-source platform for real-time viral evolution monitoring by his team. Here are examples of what he and other experts have learned so far, and the critical questions they are still pursuing. How to reduce the risk of infection. Signs: what to do if you think you may be infected. Tips for travelers to and from China, the epicenter of the outbreak. How U.S. health officials respond to the virus. What doctors and healthcare workers need to know. Bedford's and other analyses of the genetic sequences of some of the first human cases found that after it first appeared, the virus had a surprising lack of genetic diversity from person to person. First, there was not sufficient evidence to clarify what this meant. Was the virus repeatedly springing from animals to humans or, more seriously, spreading rapidly among humans after an initial animal jump? These two cases cannot be separated by DNA. Only the reservoir animal can get epidemiological data or DNA. Figuring this out will presently be the main epidemiological target for everyone. I think we're looking at a pandemic if it's not implemented early, Bedford told Stat News on January 27, though he warned it was impossible to say how serious a COVID-19 pandemic would be. Such work by Bedford and other virus trackers is possible due to the rapid genetic sequencing of infected people, unfeasible or even unlikely not too many years ago, and a collective effort to openly share such genetic data with the research community around the world. Basically, a week after reporting that there is this new thing, China's outstanding scientists have a genome for the novel virus that had never before been seen. That first genome was great for people developing quick testing to actually be able to validate cases, and these subsequent genomes are very useful in understanding simple epidemiological issues. Adding a few main samples will change the story dramatically, due to the rapidly evolving nature of the disease. With access to additional genetic sequences from more infected people, teammates from Bedford and NextStrain wrote on a post on their site on January 30 that the low mutation rate of the disease is the result of spreading person to person from unknown animals to humans in November or early December 2019 since its initial jump. The team also wrote in their January 30 report, while the virus has started to catch up mutations as it spreads among people, as this form of virus naturally does, such mutations do not appear to be related to changes in the actions of the virus. The new virus seems to be less likely to kill those with confirmed cases than its coronavirus predecessor, SARS, but data are too scant for firm conclusions. Bedford and colleagues explain their latest data on the COVID-19 spread and evolution around the world. The map shows the number and location of viral sequences they study as the virus spread out of China from cases around the world. Meanwhile, a new analysis of the first 425 people with the virus, reported by a research team based in China in the New England Journal of Medicine on January 29, found that it takes about 5 days for a person who is eventually diagnosed with the disease to develop symptoms following their initial infection with the virus. Chapter 4. Reported cases all over the world. In mid-December, the first cases of coronavirus were identified at Wuhan. The number of confirmed cases has since increased exponentially, and infections have been identified all over the world. Hospitals in Wuhan are already heavily overcrowded, and hundreds of emergency medical staff was sent to the region for assistance. 2 new hospitals are also being constructed on the outskirts of the town dedicated to treating the virus. The city's authorities said there were still more than 4,000 Wuhan residents overseas as of January 27. The Wuhan Culture and Tourism Office said after the lockdown was announced all tour groups were cancelled, but groups that left before that date were still slowly returning to the region. More than a dozen countries have reported Wuhan virus cases, as authorities are struggling to avoid its spread. More than 100 people died from a coronavirus outbreak that began in Wuhan, China, and more than 4,600 people across 17 countries were infected. The virus, characterized like symptoms by fevers and pneumonia, probably originated in a wet market in Wuhan, an 11 million person city in Hubei province of China. Authorities placed Wuhan under quarantine on January 23, stopping all public transport, including city buses, trains, and ferries. The order would bar any bus or train from entering or leaving the city and will land all planes at Wuhan airport. Wuhan authorities also started the next day to restrict car travel, The Guardian reported. Wangang City, which is home to about 7.5 million people, also locked up last week as authorities closed down subway stations and train stations. 10 additional cities, Chibi, Enshi, Ezhou, Guangxi, Suzhou, Changjiang, Xianing, Xiantao, Yichang, and Zhejiang, have followed suit with their own travel restrictions by the next day. The cities of Xiangyang, Jingmen, Shaogan, and Danyang were also in quarantine as of Monday. Wuhan is China's 5th largest city and has a size of over 3,200 square miles. In contrast, there are about 8 million people in New York City, nearly 3 million fewer than Wuhan. The town is divided into 3 districts, Hankou, Wuchang, and Hanyang, with rivers flowing in between. Most people work in one district and live in another, so the inter-district travel ban is disrupting the usual workings of the community. People are no longer allowed to leave Wuhan without a special reason, according to local authorities. Meanwhile, officials in Wangang ordered the closing of cinemas and internet cafes, and instructed people not to leave the city unless there were special circumstances, Reuters said. Long-distance buses and trains to the city have been halted. The nearby town of Ezhou, too, closed its train stations, while bus travel in 2 smaller towns, Chibi and Zhejiang, was halted. Such quarantines come among the festivities of the Lunar New Year, which began on Saturday. The annual holiday typically fills the country's trains, buses, bridges, and ferries, as 3 billion people travel home to be with their families. The Chinese government, however, has requested people to cancel plans to visit Wuhan, and last week the government in Beijing cancelled its Spring Festival activities. Several countries across Asia have put additional screening at airports and warned people not to fly to China. Neighboring Mongolia has placed tight border controls on travelers coming into the country to China's north. Indonesia and the Philippines have both imposed additional restrictions on Chinese tourists, while Japan has upgraded its response, allowing authorities to strengthen suspected hospitalization and testing cases. Around 100 cases have been reported worldwide, with most of them 14 found in Thailand, a popular destination for Chinese tourists. Countries with colder climates are more likely to spread in the future, as coronaviruses thrive in cold environments and do not replicate in warm, hot areas as well. Nevertheless, in a patient in Illinois, the Centers for Disease Control and Prevention reported the first case of human-to-human coronavirus transmission in the U.S. The transmission took place between a husband and wife, who were in close touch with each other. The partner, who was a woman in her 60s, had traveled to Wuhan, China, and was diagnosed last week with the virus. The husband, who also resided in his 60s in Chicago, and who has underlying health issues, had not traveled to China. The risk to the general public in Illinois remains low, state health officials emphasized. They said they don't think the virus spreads widely in neighborhoods and are working to ensure that healthcare workers are safe at the facility where the patient is being treated. On Thursday night, the State Department released a "do not fly" advisory to China, its strongest warning. The Level 4 warning was already in effect for the outbreak's heart, Wuhan. It also advised Americans to leave via commercial flights in China. The new coronavirus is under investigation for 165 people in the United States. Of those, 68 tested negative, and 6 tested positives. Tests of the remaining individuals are in transit or have reports pending. 20 American airports check travelers for symptoms of illness and provide coronavirus signs to people returning from China with educational materials. Several flights to China have been suspended by airlines around the world: United, Delta, American Airlines, British Airways, Air Seoul, Lion Air, Lufthansa Group, Cathay Pacific, Finnair, AirAsia, Air India, Air Canada, All Nippon Airways, Asiana Airlines and Korean Air. The U.S. government chartered a flight from Wuhan, China to evacuate 196 Americans. Such evacuees were screened and monitored before and during their flight for signs of illness. The passengers have entered voluntary 3-day quarantine since arriving in California and will be given virus monitoring according to the Centers for Disease Control and Prevention. Although most recorded cases outside of China have a direct link to Wuhan, there are signs that the virus is starting to spread within other countries. In Germany, 3 fresh cases have been stated, including what is believed to be the first human-to-human transmission in Europe. Multiple countries have advised that people do not visit China due to the ongoing outbreak. The U.S. Base for Disease Regulator and Prevention (CDC) has released a Level 3 warning recommending against all non-essential travel, the highest alert on a scale of 1 to 3. The White House, however, denied reports that it was planning to cancel all U.S.-China flights. With many of China seeing the sort of cold weather suitable for coronavirus, and continuing doubt about how contagious it is, experts expect the number of cases to continue to rise for several weeks. Zheng Nanshan, one of the leading breathing experts in China and a hero of the 2003 war against SARS, said he anticipated the peak to arrive in up to 10 days. Definitely, it is very difficult to estimate when the epidemic occurs. But it will hit the pinnacle in 1 week or about 10 days, and then there will be no large-scale rises. Other experts have warned, however, that while the Hubei outbreak could peak in the coming weeks, other Chinese megacities may see self-sustaining epidemics that continue to spread the pathogen across the country and around the world. An Australian laboratory became the first outside of China to develop the Wuhan coronavirus from a sample of patients. This will provide crucial information to foreign specialist laboratories to help combat the virus. We model epidemic curves up to August 2020 for all major city clusters: Chongqing, Shanghai, Guangzhou, Shenzhen and Beijing. Chongqing is expected to have the largest epidemic due to large population and the most extreme volume of traffic combined with Wuhan. Ecuador. On the 26th of January, Ecuador was one of the first countries outside mainland China to announce a suspected case of coronavirus. The Chinese resident, who was 49, arrived from Hong Kong and showed symptoms of the infection. The Ministry of Health of Ecuador confirmed on February 5 the alleged case of coronavirus tested negative. Botswana. In Botswana, a total of 5 suspect cases of coronavirus infection have been identified. All of the cases tested negative for the infection as confirmed by Botswana government on February 5. On January 30, the first reported case of coronavirus in Botswana was registered, the Ministry of Health and Wellness announced on January 31. The suspect arrived from China on an Ethiopian Airways flight, is isolated and under investigation. Czech Republic. Until the end of February 4, a total of 48 individuals were screened for the novel coronavirus and all of them tested negative, the Czech Ministry of Health has confirmed. Respilan Group, a Czech-based nanofiber technology company, announced it was developing a new face mask that could limit the spread of coronavirus. Namibia. On the 1st of February, Namibia Broadcasting Corporation (NBC) announced that a 30-year-old woman with symptoms similar to those of coronavirus is being observed in a hospital in Swakopmund, Namibia. The woman had visited Melbourne, Australia and arrived at the international airport in Hosea, Kutiko. He noticed that their flight back included Chinese passengers wearing masks and coughing. The Namibia Ministry of Health reported the news of the suspect case, NBC added. The Namibian Minister of Health announced on the 3rd of February that the alleged case has tested negative. Peru. The Peruvian Ministry of Health reported in its most recent February 3rd update that there are no confirmed cases of coronavirus in the region. The ministry announced earlier on January 31st that all 4 alleged to have tested negative coronavirus. Maldives, which is already working hard to control a measles outbreak, witnessed a male who arrived from Xiamen, China, on the 30th of January in the first reported case of coronavirus. 6 other cases of Maldivians who traveled to China were subsequently identified. The Ministry of Health of Maldives confirmed on the 3rd of February that all cases had tested negative for the virus. Myanmar. A Chinese visitor's first suspected case of coronavirus in Myanmar was registered on the 31st of January. The visitor arrived from Guangzhou, on a flight from China Southern Airlines in Yangon. Of the remaining 78 passengers that the flight carried, only 2 were allowed to disembark the plane, while the remaining 76 were not, Anadolu Agency reported. Nevertheless, Myanmar reported that the suspected case has checked the virus as negative. Ivory Coast. Côte d'Ivoire. The Ivory Coast confirmed 1 suspected case of coronavirus infection on the 26th of January 2020. The woman, a 34-year-old female student, had arrived in the Ivory Coast from Beijing to Abidjan. She was placed in solitary confinement and was healthy during the observation period. Her samples have tested negative for coronavirus, officials announced. Ethiopia. It was confirmed that 4 people suspected of contracting the coronavirus infection and put in isolation in Addis Ababa had tested negative for the infection. 4 of them are students who study at Wuhan City Universities. Kenya. On the 30th of January 2020, Kenya announced that the first confirmed case of coronavirus infection had tested negative. The case was a Guangzhou traveler who showed symptoms of the disease, first published on the 28th of January 2020. He was first placed in solitary confinement at Jomo Kenyatta International Airport upon arrival and then isolated at Kenyatta National Hospital's Infectious Disease Unit. Test results revealed the sufferer was common cold but not the infection of coronavirus. Austria. A total of 7 Austrians who came from China and quarantined at the Hygiene Center Vienna on February 4 tested negative for coronavirus infection. On February 2, the 7 people arrived in Austria and are relate as a precautionary measure. Mexico. 7 suspected cases of coronavirus infection recorded in City, Mexico, all of which tested negative on January 27. The suspected cases included a 42-year-old man, who visited Wuhan recently, and a 37-year-old woman and a 2-year-old girl who came in touch with the man. Actually, they receive medical treatment for other respiratory diseases. In Jalisco, the 20th of January, a further 3 cases were reported. New Zealand tested negative on the 31st of February, the first reported case confirmed in New Zealand. Dr. Ashley Bloomfield, the Director General of Health, announced the test results on the 1st of February. The individual was accused of contracting the disease and was held at Auckland City Hospital in solitary confinement. Cyprus. According to the Cyprus News, a man from China who was accused of contracting the infection with coronavirus tested negative on the 2nd of February 2020. The man was put under quarantine at the General Hospital of Nicosia on January 31, after showing symptoms of the illness. Croatia. According to Total Croatia News, a man held in solitary confinement at Split KBC Hospital for showing symptoms of coronavirus infection tested negative on the 3rd of February. He was suspected of having contracted the infection after visiting China recently on the 2nd of February. Switzerland. According to SWI, on the 28th of January, 2 suspected cases of coronavirus infection had tested negative. The 2 cases were first identified on January 27 and placed in solitary confinement at Zurich's Triemli Hospital. The people had recently visited China and returned with infection symptoms. Greece. According to the Greek City Times, a 60-year-old man suspected of contracting coronavirus has tested negative for the disease. The man had been put under quarantine at the General Hospital of AHEPA University. Denmark has confirmed that as of February 4 all those screened for suspected coronavirus have turned out negative. The most recent tests have been on those arriving from Wuhan at Roskilde Airport. Earlier, a Danish woman who returned from Wuhan with infection symptoms was isolated and examined at Aarhus University Hospital. The test has been proven negative. Ireland suspected a person who came from Wuhan to be infected with coronavirus and admitted him to the Royal Victoria Hospital, but the health department announced that the tests were negative, the BBC reported on the 25th of January. On the 31st of January, the World Health Organization identified 13 countries on the continent of Africa as at risk for coronavirus infection. Such nations include Algeria, Angola, Côte d'Ivoire, the DRC, Ethiopia, Ghana, Kenya, Mauritius, Nigeria, South Africa, Tanzania, Uganda and Zambia. Either they have direct links to China or they manage a large volume of trips to China. Active screening programs were implemented at all of those countries' major airports. Chapter 5. OMS Global Health Emergency. With no indication that a new coronavirus epidemic is fading, virologists are waiting around the world to get their hands on the virus, physical samples. We are developing plans for testing drugs and vaccines, creating animal models of the infection and researching concerns about the virus, nature such as how it spreads. The moment we heard about this outbreak, virologists started putting out their feelers to gain access to the isolates. At the epicenter of the outbreak was the first laboratory to isolate and study the virus, known provisionally as COVID-19, in Wuhan, China. A team led by virologist Zheng Lixi at the Wuhan Institute of Virology isolated the virus from a 49-year-old woman, who developed symptoms on the 23rd of December 2019 before becoming critically ill. Xi's team found that the virus can destroy human cells that are cultured and enter them through the same molecular receptor as another coronavirus, the one that causes SARS, severe acute respiratory syndrome. On the 28th of January, a laboratory in Australia confirmed it had collected virus samples from an infected person who had returned from China. The team was getting ready to share these findings with other scientists. Laboratories in France, Germany and Hong Kong are also isolating and planning to exchange samples of viruses from local patients that they collected. Nevertheless, at a news conference in Geneva, the World Health Organization declared coronavirus to be a public health emergency of international concern. It's only the 6th time such an emergency has been declared, with past examples including the Democratic Republic of Congo Ebola outbreak and the Zika virus. Through seeking to spread worldwide, the WHO reserves the designation for extraordinary events that present a public health risk. The step reversed the organization's decision to hold off such a statement just a week earlier. Since then, several other nations, including the United States, have seen thousands of new cases in China and clear evidence of human-to-human transmission. This all warranted reconsideration by the Emergency Committee of the WHO. The statement is not a vote of mistrust in China. The WHO, on the contrary, appears to believe in China's ability to control the outbreak. The announcement now comes because of concerns that the coronavirus could enter countries with poor healthcare systems where it could run amok, potentially infecting millions of people and killing thousands. The State Department warned travelers to avoid China altogether following the declaration. The spokeswoman for China's foreign ministry, Hua Chunying, said, "The country is fully confident and able to win the fight against this epidemic." She added in a statement on the ministry's website that China is willing to continue collaborating with the WHO and other countries to protect public health. The announcement of the WHO, officially called an international public health emergency, does not have the force of law. The department is governed by an annual meeting of all UN ministers of health. Countries and their function are merely to provide instruction. Governments will now make their own conclusions about how to protect themselves. To Americans concerned about their health, the best advice are to follow good flu season hygiene, including regular hand washing, covering coughs and keeping up to date on new CDC details. The CDC does not suggest wearing a face mask to avoid coronavirus. Our conclusion remains that there is low immediate risk for the American public. The Illinois transmission is the sixth coronavirus outbreak in the USA. Last week the WHO deliberated for 2 days before agreeing not to declare an emergency. Nevertheless, patients from Germany, Japan, Taiwan, Vietnam and the United States have since been infected with the new coronavirus without visiting China. The new coronavirus is within the same virus family as common cold and SARS. A lot of uncertainty emerges from that human-to-human transmission outside China. At last count, the novel coronavirus has sickened more than 7,700 people, and 170 have died from it. More than 90%, and every death, of those cases were in China. 20% of cases are considered serious, and 2% have been fatal, according to World Health Organization. The fatality rate of the latest coronavirus is expected to decline as more cases are identified, as the sickest people tend to seek first medical treatment. Emergency systems are just instructions. Governments and even private firms may or may not obey it. However, announcements of emergency signal that the situation is critical for the world's top health advisory body. The decision had been accepted by many scientific experts. The emergency in public health allows them to rely further on the role of global leadership for governments and the private sector. The first aim should be to learn more about how the virus spreads, whether it's mostly in hospitals and clinics, what ages and sexes or occupations are most affected, how sick they are, and what risk factors are most harmful. Yet Amir Attaran, a law and epidemiology professor at the University of Ottawa and a frequent critic of WHO, called the announcement inexcusably late. The committee's rationale that it lacked sufficient scientific evidence to declare an emergency last week was balderdash, he said. WHO is crippled with SARS, Ebola and Zika for the same political reasons that destroyed its scientific judgment, he said. Borders are closed, planes are grounded and ships anchored like WHO are quietly dithers about whether or not to declare an emergency. Things have overtaken them greatly, proving the uselessness yet again, he said. Declaring emergencies is always a tough decision to take. Border closures and cancellations of flights will cause misery for millions of healthy people close to the epicenter, and huge economic disruption. In the worst situations, food and medicine supplies can run short, and fear can spread, threatening to do more harm than the disease. Experts at the WHO, however, have lavishly and consistently praised the response by China as exceptionally violent. In just 2 weeks, the nation has built 2 hospitals for the home of patients with coronavirus. Chinese scientists deposited the coronavirus genetic signature in public libraries, which greatly accelerated the production of diagnostic tests and, eventually, vaccines. The Chinese authorities cordoned off the major cities at the epicenter of the epidemic, Hubei province, stranding over 50 million people at the height of New Year's lunar holidays, a step that few other countries could have taken. It remains to be seen whether that massive cordon can prove effective. 5 million people were able to flee Wuhan, the city where the outbreak started, before it closed its train and bus stations and airports. The Chinese government has set a new standard for response to the outbreak. Many countries should be thankful that only 98 of the nearly 10,000 cases reported so far have taken place outside of the borders of China, he said. Notwithstanding the state of emergency, and notwithstanding the fact that the State Department is advising Americans to stay away from China, the WHO is opposed to limits on travel to or trade with China. According to the president of the agency's emergency committee, steps the agency finds unwarranted include border closures, visa restrictions and the quarantining of apparently healthy travelers from affected regions. Other countries have already taken many of those steps against China. That's not to say that there weren't missteps. Last week, the WHO described its outbreak risk assessment as moderate, when it should have said high. The mistake was added to the agency's report in a footnote. US researchers have written about spotty epidemiological knowledge coming from China. The WHO, too, cannot share information with Taiwan, which now has 8 patients with coronavirus, as Taiwan is not a member of the UN. The corporation does not want its main stakeholders to get upset. China holds the political clout many countries don't have. Yet, along with its effects, the epidemic seems to be accelerating. On Friday, China said another 43 people had died of the disease, bringing the total to 213. There have yet to be any fatalities outside China. Russia sealed much of its 2,600-mile boundary with China and halted all of the country's train service except for a regular train between Moscow and Peking. Several airlines, like British Airways, stopped flying there. Others reduced their service considerably. Some medical experts within China have challenged the response from the government, arguing that local officials should have implemented more stringent travel restrictions before the virus spills out of Wuhan. The country now has cases confirmed in every province and area. People have argued that local authorities kept quiet about the extent of the outbreak, initially maintaining that there was no proof of transmission from person to person outside Wuhan, but admitted the truth after Hong Kong press reports. As the magnitudes of the outbreak became vivid, Wuhan's mayor offered resignation on Monday. A delegation from the WHO was authorized to visit Wuhan for only 1 day of rain. He said the visit was not intended to pass judgment. Everything is performed with a sense of strength and good practice, to three's evaluation. You need to recognize the large scale and comprehensiveness of the project. After the tour, China agreed to allow WHO-coordinated international experts to collaborate with Chinese scientists to control the outbreak in the region. A team to join them is assembled by the CDC since its formation in 2005. The WHO has made only 5 emergency declarations: for the 2009 pandemic influenza, for the 2014 polio resurgence, for the West African Ebola epidemic during that year, the Zika virus erupt in 2016, and an Ebola outbreak in the Democratic Republic of Congo last year. The country has taken very strong steps, including daily contact with WHO and robust multi-sector strategies to avoid further spread. In other cities and provinces, it has also taken public health measures, is conducting studies on the magnitude and transmissibility of the virus, and sharing data and biological content. The country has also agreed to work with other countries that require support from them. The steps that China has taken are positive for that country as well as the rest of the world. The committee recognized WHO and its collaborators as leading role. The committee also noted that many unknowns remain. Cases have now been identified in 5 WHO regions within 1 month, and human-to-human transmission has occurred outside of Wuhan and outside of China. The committee claims that it is still possible to prevent the spread of virus if countries put in place effective measures to identify disease early, isolate and treat cases, monitor interactions and encourage risk-sensitive social distancing steps. It is important to note that as the situation continues to evolve, the strategic objectives and measures to prevent and reduce the spread of the infection will also evolve. The committee concluded that the epidemic now meets the criteria for a globally concerned public health emergency, and offered the following advice to be given as temporary recommendations. The committee emphasized that a PHEIC's statement should be interpreted in a spirit of support and respect for China, its citizens, and China's actions on the front lines of this outbreak, with openness and, it is to be hoped, progress. In line with the need for global unity, the committee felt a need for an internationally coordinated effort to improve preparedness in other parts of the world that might need additional support. The committee welcomed an upcoming multidisciplinary technical mission to China which included national and local experts from the WHO. The mission will examine and support efforts to investigate the animal source of the outbreak, the clinical scope and nature of the disease, the degree of human-to-human transmission within the population and in healthcare facilities, and efforts to control the outbreak. This mission will provide the international community with information to assist in understanding the situation and its effects and facilitate exchange of knowledge and effective action. The committee wished to re-emphasize the importance of researching the possible source, excluding secret transmission and informing steps for risk management. The committee also underlined the need for enhanced surveillance in non-Hubei areas, including pathogen genomic sequencing, to understand whether local transmission cycles are occurring. World Health Organization should continue to use its international specialist networks to determine how best to control the outbreak globally. WHO should provide enhanced preparatory and response support, especially in vulnerable countries and regions. Measures should be established to ensure rapid development and access for low and middle-income countries to future vaccinations, medications, antiviral medicines and other therapies. WHO should continue to provide all the technical and operational support necessary to respond to this outbreak, including with its broad networks of partners and collaborating organizations, to adopt a robust risk communication strategy, and to allow research and scientific advances in relation to this novel coronavirus to be furthered. The WHO will continue to explore the advisability of establishing an intermediate level of warning between the binary possibilities of PHEIC or no PHEIC, so that discussions on the IHR text do not need to be reopened. 2005. The WHO will review the situation with consistency in due time and update its recommendations based on evidence. The committee does not propose any restrictions on travel or trade based on the current available information. The Director General announced that the COVID-19 outbreak constitutes a PHEIC and acknowledged the advice of the committee and released this advice as temporary recommendations under the IHR. To the People's Republic of China, develop a systematic risk communication strategy to inform the public on a regular basis about the nature of the outbreak, the population's prevention and security measures, and the response measures taken for its containment. Improve public health programs to curb the current outbreak. Ensure health system stability and secure health care workers. Increase monitoring and successful case finding across China. Collaborate with the WHO and its collaborators in carrying out studies to clarify the epidemiology and evolution of this epidemic and its control steps. Partake of appropriate human case info. Continue to identify the zoonotic source of the outbreak as soon as it becomes available, and in particular the potential for circulation with WHO. Perform exit screening at international airports and ports with the goal of early detection for further assessment and treatment of symptomatic travelers while reducing interference with international traffic. To all countries, more foreign export of cases is expected to appear in any region. All countries should therefore be prepared for containment, including active monitoring, early detection, isolation and case management, communication tracking and prevention of further spread of COVID-19 infection, and full data sharing with World Health Organization. Professional guidance can be found on the WHO website. Countries are reminded that they are legally obliged under the IHR to share information with the WHO. Any identification of the COVID-19 in animals, including species information, diagnostic tests and relevant epidemiological information, should be reported as an emerging disease to the World Organization for Animal Health (OIE). Countries should place particular emphasis on reducing human infection, preventing secondary transmission and international dissemination, and contribute to international response through multi-sector cooperation and collaboration and active participation in enhancing virus and disease awareness, as well as advancing research. The committee does not propose any restrictions on travel or trade based on the current available information. Countries shall inform WHO, as required by the IHR, of travel measures taken. Countries are warned against acts encouraging stigma or prejudice, in accordance with the IHR's Article 3 principles. In view of this rapidly evolving situation, the committee requested the Director General to provide further guidance on these matters and, if necessary, to make new case-by-case recommendations. To the global community, as this is a new coronavirus and it has been shown previously those similar coronaviruses require substantial efforts to allow routine information sharing and analysis, The global community will continue to show solidarity and cooperation in supporting each other in identifying the source of this new coronavirus, in compliance with Article 44 of the IHR 2005. Help low and middle income countries to respond to this incident and to promote access to diagnostics, possible vaccines and therapies. Under Article 43 of the IHR, states parties adopting additional health measures that substantially interfere with international traffic, refusal of entry or departure for more than 24 hours of international travelers, luggage, freight, containers, conveyances, goods and the like, are obliged to send to the WHO a rationale and justification for public health within 48 hours of their arrival. WHO will review the reasoning and may ask countries to rethink their steps. WHO is required to share information regarding interventions and the rationale obtained with other states parties. The UN's health arm said the move was to protect countries with weaker health systems, but the WHO also said there was no excuse for steps that would interfere excessively with international travel and trade. Chapter 6. Preventive measures by countries. Scientists and health specialists around the globe are trying to stop the spread of a deadly virus that originated in December in the Chinese city of Wuhan. The new coronavirus has already been contracted by thousands of people, which cause respiratory disease. The death toll is 213, and increases regular. The outbreak was declared a public health emergency of international concern by the World Health Organization (WHO) on the 30th of January, a warning it reserves for incidents that pose a risk to multiple countries and that involve a concerted international response. How many people will the virus infect? The Chinese authorities have locked down cities at the center of the outbreak, and researchers have been swift to share virus data with the World Health Organization and with researchers. But the numbers of cases have increased, and past 9,000 have surged in the past day, mostly in China. This has resulted in one estimate that the virus could infect about 39,000 of the 30 million people living in the Wuhan region. It seems like the virus got out of hand in China, spreading too far, spreading too quickly to really be controlled. In the best case, fewer people will get infected because the results of the control measures will start kicking in, says University of Hong Kong epidemiologist Ben Cowling. But it's too early to tell if efforts are working to quarantine men, and the common use of face masks. The virus incubation period up to 14 days is longer than most prevention measures are in place, he notes. In a worst-case scenario, according to another prediction model, some 190,000 people could get infected in Wuhan. Scientists are particularly concerned by the appearance of fresh outbreaks outside China. The virus has already spread in small, scattered clusters in Vietnam, Japan, Germany and the US, but officials were able to isolate the affected people. As of January 30, fewer than 100 cases were reported outside China. Is the virus here to stay? It is said to be normal when a virus circulates continuously in a population. In many countries, the viruses that cause chickenpox and influenza are common, but outbreaks can be managed through vaccination and holding people at home when they're sick. One big question is if the coronavirus is here to live, too. When attempts to eradicate it fail, then there is a high likelihood it will become widespread. This could mean, as with influenza, that deaths occur every year as the virus circulates, until a vaccine is created. When people who are infected but do not have symptoms will spread the virus, it will be harder to control its spread, making it more likely that the virus will become endemic to them. Some cases of infected people with no symptoms have occurred, but it is still uncertain whether such asymptomatic or mild cases are normal and whether or how contagious they are. Probably we are looking at a virus that will be with us for a long time, possibly forever, Mackay says. Asymptomatic cases differentiate the new virus from related coronavirus, which causes severe acute respiratory syndrome, SARS. This virus had a global epidemic in 2002-03 but usually only spread until people were sick enough to need hospital care. When outbreaks were brought under control in hospitals, SARS had been controlled. There's no proof the virus continues to spread in humans, says Mackay. If control measures are successful, and transmission slows down so that no more than one person infects per infected person, the current outbreak may simply peter out, Cowling says. Is the virus likely to change? Some researchers are worried that the pathogen will mutate as China's coronavirus spreads so that it can spread more easily, or become more likely to cause disease in young people. The virus has currently caused severe illness and death, particularly in older people, especially those with pre-existing conditions such as diabetes and heart disease. The youngest victim identified so far is a 36-year-old Wuhan man with no documented pre-existing health conditions. Christian Anderson, a Scripps Research infectious disease expert in La Jolla, California, is not concerned about the virus becoming more virulent. He says viruses are continually mutating as part of their life cycle, but these mutations usually don't make the virus more virulent or cause more serious illness. I can't think of any cases of this having happened with pathogenic outbreaks, he says. In cases where a virus moves from one animal host to another species, which is possibly how the current coronavirus began infecting humans, there may be a selection pressure in the new host to enhance survival, but that seldom, if ever, affects human disease or the transmissibility of the virus. Some mutations damage the virus, or have no consequence. A 2018 study of SARS in primate chambers showed that his virulence was possibly diminished by a mutation sustained by the virus during the 2003 epidemic. Scientists have exchanged hundreds of genetic sequences from the latest coronavirus strains, and a steady supply of those samples will show genetic changes as the epidemic progresses, Mackay said. If they change sequence, viruses do not change behavior, and we need to see persistent or consistent virus change, he says. How many people will it kill? The fatality rate for a virus, the proportion of infected people who die, is difficult to calculate in the midst of an outbreak as reports are continuously being updated on new cases and deaths. The fresh coronavirus has a decease amount of 2 to 3% with 213 deceases so far out of nearly 10,000 infections. This is expressively lesser than SARS, which killed about 10% of its infected people. The reported mortality rate for the latest coronavirus is likely to decline as mild and asymptomatic cases are detected, virologist Mark Harris at Leeds University, UK, told London's Science Media Centre. There are no effective drugs against the virus at this time. 2 HIV treatments that are thought to target a protein that helps replicate coronaviruses are being studied as a cure. Many current medicines that target this role have also been identified by scientists, and numerous intercontinental investigative groups are operating on a serum. The amount of deceased will also depend on how the large number of cases copes with China's healthcare system. Putting people on drips and ventilators will make sure they get enough fluids and oxygen while the immune system in their body battles the infection. China is constructing 2 new hospitals in Wuhan to treat sick people, but if the virus spreads to parts of the world with fewer resources, such as African income regions, their health systems could fail, says Sanjaya Senanayake, an infectious disease specialist at Canberra's Australian National University. The Director General of the WHO, Tedros Adhanom Ghebreyesus, said his main concern in announcing a global health emergency was that the epidemic could spread to countries with weak healthcare systems. If the virus is spreading all over the world, the number of deaths could be significant. For an infectious disease, the current death rate of 2 to 3%, although not as high as for SARS, is still quite high. The epidemic of influenza in 1918, known as Spanish flu, affected about 500 million people at the time, 1/3 of the world's population, and killed more than 2.5% of those infected. Others reported that as many as 50 million people died. The China coronavirus is unlikely to induce such an apocalyptic scenario, because it does not usually infect or kill healthy young people. How long will it take to exploit a serum? A vaccination is still 1 year away, at least. A coronavirus vaccine may prevent infection and stop the disease from spreading. But it does take time for the vaccines. While new technology, advances in genomics and improved global collaboration have enabled researchers to move at unprecedented pace, vaccine development remains a costly and risky operation. Scientists usually have to start from scratch with every new outbreak. After the 2003 SARS outbreak, it took about 20 months for researchers to get a vaccine ready for human trials. The vaccine was never needed, because it ultimately contained the disease. By the 2015 Zika outbreak, experts had brought down the timetable for vaccine development to 6 months. Now, they are hoping research from previous outbreaks will help further cut the timeline. Scientists have already researched the current coronavirus genome and identified the proteins that are essential to infection. National Institutes of Health scientists in Australia and at least 3 companies are working on candidates for vaccines. If they do not face any unexpected challenges, a phase 1 trial can be completed within the next 3 months. The experts warned that it may also take months, and even years, to carry out extensive testing after initial trials that can confirm a vaccine is safe and effective. A vaccine will, in the best case, be made available to the public a year from now. What if I'm traveling? Traveling to China at that time is possibly ill-advised. It is not clear how the virus can be transmitted, and who is at the greatest risk of a poor result. Hubei has been given a Level 4 travel advisory by the U.S. State Department, which means, do not fly, and is the highest level of alert. For the rest of China, a Level 3 alert is in place. The biggest risk of travel to China right now is that the Chinese government has imposed stringent quarantine and travel bans. That said, if you have to go to China where there are reports of the virus, experts recommend that you wear a mask, wash your hands regularly and avoid anyone who's sick. Remember that over-the-counter masks do not protect against airborne diseases, and masks will be ineffective if the virus mutates to become airborne. In the United States, the CDC is closely monitoring the status. There are a total of 165 cases under investigation as of the 29th of January 2020. 4 were upheld. Arizona, Washington, California and Illinois are the states with confirmed cases. Should I wear a surgical mask to protect myself? If you have a respiratory infection, wearing a mask will help protect the people around you from getting sick by reducing the risk of spreading the infection. And if there is an epidemic, wearing a surgical mask may somehow protect you from infection in a crowd. However, in general, surgical masks are not sufficiently close-fitting to absorb all the air you breathe in, and the heavy-duty N95 respirators are extremely uncomfortable. Experts recommend you regularly wash your hands throughout the day. Stop touching your face, and keep a distance from anyone who coughs or sneezes. Apparently, the risk of infection in the United States with the latest coronavirus is far too small for the general public to start wearing a face mask. If you have signs of a respiratory disease, however, wearing a mask reduces the risk of infecting others. I've arranged a trip to China. Should I go? I have a trip planned to China. Should I go? Do not go. The Department of State has warned Americans not to go to China unless it is absolutely necessary. If it is appropriate for visitors to go, the CDC recommends improved precautions. Avoid contact with anyone who is ill, as well as with the animals and markets in which they are sold, and avoid eating raw or undercooked meats. Anyone who is older or has an underlying health problem that raises infection vulnerability should check with a health care provider before making a trip. Considering the outbreak, access to medical care in China may be difficult, and federal officials have warned that new travel restrictions, including quarantine, may be placed upon return. Several airlines have cancelled flights to China, and many passengers have been left in limbo when looking for bookings to change or cancel. What are health authorities doing to contain the virus? It is no surprise that 2020 began a new decade in China with the announcement of a novel threat to coronavirus COVID-19. Changes in human behavior and environmental factors have led over the past 3 decades to the emergence of more than 30 novel infectious diseases, ranging from rotavirus, which causes infantile diarrhea, to Middle East respiratory coronavirus syndrome, first identified in 2012. As the human populace remains to grow, Demand for agricultural land is increasing, exposing livestock and humans to wildlife infections. Climate change is also changing the environment and animal vector abundance, and rapid expansion of air traffic, people's movement through different borders, political instability and conflicts means that these new diseases can easily spread around the world. China took drastic measures to prevent people from leaving affected areas, but 5 million people left Wuhan alone before the restrictions came into effect. On the 8th of December 2019, the Chinese government confirmed the deaths of 1 patient and 41 others hospitalized with unknown etiology in Wuhan, a city in central China too with an estimated population of approximately 10 million and a major transport hub. 3. The government shut down a seafood market known to sell live exotic small animals for food on the 1st of January 2020, less than a month after the first patients were identified, of which most of the 41 laboratory-confirmed cases were found to have ties. People were also told to wear the masks in public to prevent the disease from spreading. 2 new hospitals are being built for patients with coronavirus, the first one opened Monday. Governments around the world have screened new Chinese travelers for signs of illness, and some have gone even further, barring people from China from entering. Most of its borders with China were closed by Russia and Mongolia. Australia has said it will evacuate Wuhan citizens and quarantine them on Christmas Island for 14 days. A consortium led by Chinese scientists and foreign researchers was quickly coming together in a massive effort of national and international cooperation. These included the Shanghai Public Health Medical Center and Public Health School, Wuhan Central Hospital, China's Center for Disease Control and Prevention (CDC), Huazhong University of Science and Technology, the Wuhan Center for Disease Control and Prevention, the National Institute for Communicable Disease Control and Prevention, and the University of Sydney, Australia. By the 10th of January 2020, the group had sequenced and publicly released partial sequences obtained from a Wuhan patient showing at least 70% genetic material similarities to severe acute respiratory syndrome, SARS-5. This openness in sharing information about the sequence is crucial to the production of diagnostic tests and future treatments and vaccinations to help control the outbreak, should it spread widely. The sequences were deposited in GenBank code MN908947 for accession. Recent findings appear to suggest that the COVID-19 fatality, 2 deaths out of 48 laboratory-confirmed cases, or 4.1%, may be smaller than that of SARS. A better understanding of the COVID-19 animal reservoir, pathogenesis, epidemiology and clinical continuum also needs to be provided. The response to this new outbreak by the Chinese government has been swift and decisive. This indicates a marked departure from public health policies that led to the deaths of 774 people during the 2002 SARS epidemic, the spread of the disease to 37 countries and an economic loss of more than $40 billion United States dollars over a 6-month period. 7. It is clear that China has made significant progress in responding effectively to disease outbreaks in just less than 2 decades. First, a notable change in the political stance of public health has prompted China to accept that a novel coronavirus exists quite early on. The Chinese government did not report the irregular new infection to the World Health Organization until 4 months after the first case was identified, in reaction to the 2002 SARS outbreak. Second, the government was proactive in closing the seafood market in Wuhan, taking lessons from the 2002 SARS outbreak, which only came to an end when the palm civet eaten in China was later identified as the source and withdrawn from the markets. Thirdly, the rapid development of a national and international consortium has helped to diagnose the virus quickly and make the sequences available to the public within a few days. By comparison, on the 24th of March 2003, 5 months after the first cases were reported in November 2002, the first laboratory sequences indicating a new coronavirus was the cause of SARS. The 2002 SARS epidemic clearly demonstrated the vulnerabilities of their leading public health organization, the China CDC program. Nevertheless, once the epidemic ended, through the Field Epidemiology Training Program, the government prioritized improvement of CDC processes, improving public health monitoring and laboratory services, as well as the Workforce Development Program. No doubt this increase in key public health systems and facilities will be crucial in the response to the current outbreak of COVID-19. Nevertheless, an assessment performed in 2012 revealed the impressive progress made by China CDC since 2002, resulting in quicker responses to emerging epidemics, with the overall comprehensiveness of public health services increasing dramatically from 47.4% to 76.6%. China CDC has played a critical role in improving the country's tiered national public health system. The agency has also acknowledged that global disease risks will impact China. Therefore, it is now actively exporting its expertise to help other developing countries better prepare for and respond to emerging pathogen outbreaks, including active support for the 2013 epidemic of West Africa's Ebola virus. CDC teams also support state health investigations of illnesses, including contact monitoring, which ensures that anyone who may have been in touch with an infected person is warned of exposure and monitored. The research will enhance knowledge of the virus and how it can be stopped from spreading. CDC teams have also offered to send experts in public health to China to help with the testing and containment efforts. The strengthening of the Chinese Center for Disease Control and Prevention was a turning point in region outbreak responses. That reflects very important progress and development for the security and diplomacy of global health. Building hospitals for coronavirus care and treatment. China planned the opening of Dabi Mountain Regional Medical Center, a 1,000-bed hospital, by expediting its building and opening it to people with coronavirus symptoms in quarantine on the 29th of January. It is also building a second quarantine hospital called Li Shenshan with up to 1,500 beds in Wuhan. A new 1,000-bed hospital, called Shenshan Hospital, has been completed in just 10 days to provide better care and treatment for patients with coronavirus. The new temporary hospital was opened on the 3rd of February to admit patients. China has planned to turn 11 facilities across the city of Wuhan, including gymnasiums, exhibition centers and sports centers, into makeshift hospitals with over 10,000 beds to treat patients with mild symptoms. 8 additional sites to be converted into hospitals were announced. On the 3rd of February, the first 3 hospitals were converted, offering 3,400 beds for treating patients. Furthermore, 20 mobile hospitals and 1,400 nurses from across the country were sent to Wuhan to treat patients with mild symptoms. There was also the construction of an infectious disease hospital in Zhengzhou, Henan Province. In collaboration with a biopharmaceutical firm, developed 2 diagnostic kits for the novel coronavirus antibody by the Wuhan Institute of Virology of the Chinese Academy of Sciences. The infection is detected in just 2 hours or more using an improved test method developed by Wuhan University's Zhongnan Hospital, which has helped to start care sooner and improve recoveries. The National Medical Products Administration also licensed on January 26 2 diagnostic kits and a test system developed by biopharmaceutical companies based in Hubei. Meanwhile, vaccine development efforts are advancing, with 2 chemical compounds found to be successful in controlling the viral activity that will help the novel coronavirus accelerate drug development. Wuhan Jinyintan Hospital was the earliest to use Calitra, lopinavir, ritonavir, a treatment for HIV/AIDS, to treat patients with novel coronavirus, and to note that it is safe. The Chinese Academy of Sciences has provided open and free access for Chinese researchers to resources and services from the China Science and Technology Cloud, CSTC, to assist in the COVID-19 work. To promote cooperation with core researchers must gain access to high-performance computing and software, and other tools. Baidu Research has allowed gene testing agencies, disease control centers and research institutions to use LinearFold, their RNA structure algorithm that will help understand the virus and screening compounds in less than half a minute compared to roughly an hour before. Why Africa should be prepared. As of January 20, 2020, the Chinese government announced 136 new cases of infection with this virus that spread to other cities across the country over the weekend, bringing the total confirmed cases to over 200 worldwide. Ref. 10. Cases of COVID-19 infection have now been identified in several other countries in the region. A case of COVID-19 infection of a 61-year-old Chinese tourist from Wuhan in Bangkok was registered in Thailand on the 8th of January 2011. On the 10th of January 2010, a male patient was confirmed to be hospitalized by the Japanese Ministry of Health and tested positive for the virus. It also reported suspected cases in Hong Kong and Singapore. The study of the models has suggested that more than 1,700 people could have been contaminated. The study, which had a broad confident interval of 95% ranging from 427 to 4,471, made assumptions based on the vast international air traffic from Wuhan, which is a travel hub, and the patients' incubation periods in Thailand and Japan. As a consequence of air traffic and vast population movements, the rapid spread of COVID-19 in Asia will matter in Africa. Africa was largely spared the SARS epidemic in 2002, as only one case was recorded in South Africa, a businessman who had traveled to Hong Kong. But as a result of the rapid expansion of Chinese investment in Africa 18, air traffic between China and Africa has risen by more than 600% in the past decade. For example, Ethiopian Airlines, Africa's largest airline, today operates nearly half of Africa's 2,616 annual flights to China 18. Therefore, African countries need to be on the alert and improve their public health surveillance and laboratory networks, coordinated by functional national public health agencies, to better prepare to prevent, identify and monitor any potential spread of the novel virus on the continent, rapidly. Efforts between the Africa Centers for Disease Control and Prevention, based in Addis Ababa, Ethiopia, and China CDC for sharing information on potential people suspected of being sick traveling from China to Africa also need to be more organized. China's political openness to timely coverage and the discovery of the novel COVID-19 virus, together with the rapid sequencing and public dissemination of the sequences, represents a new dawn for global health security and international health diplomacy. Additionally, there is hope that China CDC's much strengthened networks will produce a huge return on public health investment in combating the outbreak, should it spread more widely in China. It will also improve health protection for the world, as the global health chain is only as strong as its weakest link, so a threat to disease will easily become a threat anywhere. List of countries that have restricted or banned Chinese tourists or visitors. On the 2nd of February 2020, the US released the highest level of travel advisory, level 4, and instructed its citizens not to fly to China. It also encouraged US people in China to leave as far as possible through commercial means or stay home while avoiding contact with others. On the 1st of February 2020, Australia announced strengthened border control measures to curb the spread of the virus. All incoming passengers are subject to enhanced screening measures and, as of the 1st of February 2020, passengers leaving China are denied entry. The trip excludes Australian nationals, permanent residents and members of their immediate family. New Zealand imposed temporary travel restrictions for all foreign nationals coming from China into the country. The limits were set for up to 14 days and should be checked every 48 hours. On the 3rd of February 2020, Maldives announced new border security measures to limit the entry of all passengers from China, except Maldivian nationals or those who have transited through China. Maldivians were also warned against non-essential travel to China and other countries affected by the virus. Indonesia, Israel, Iraq, Italy, Honduras, El Salvador, Oman, Saudi Arabia, Russia, Japan, Vietnam, Singapore and Pakistan are some of the other countries that either have placed travel restrictions or cancelled direct flights to China, as stated by the BBC and Reuters. Fiscal measures to minimize economic impact, liquidity infusion and tariff cuts. Coronavirus outbreaks will have a greater negative impact on the global economy than the outbreak of SARS, severe acute respiratory syndrome, in 2003. As any recession in the Chinese economy would not send ripples but waves around the globe, IHS Markit said Friday. The epidemic has brought to a standstill large part of the world's second-largest economy and its influence has been felt through industries. Coronavirus will have a greater negative impact on the global economy than was the 2003 SARS outbreak. China was the sixth biggest economy at the time of SARS, accounting for only 4.2% of world GDP. China is now the second largest economy in the world, accounting for 16.3% of global GDP. Therefore, any downturn in the Chinese economy does not send ripples but waves across the globe, IHS said in a commentary on coronavirus outbreak. In this case, the coronavirus and the subsequent measures will reduce global real GDP by 0.4% in 2020. On the other hand, if containment measures begin to rise on February 10, the impact on global GDP will be more minimal, leading to 0.1 per centimeters. The effects of coronavirus in household consumption are most pronounced and somewhat mitigated in the industrial sector because factories are seasonally idle during this time period. Nonetheless, China's economy today is more fragile in many ways than it was in 2003, with production and overall economic growth already slowing and the consequences of the trade dispute between the US and China, it said. Because SARS and its effect on the world economy are now much bigger, China's GDP has risen dramatically. Chinese growth slowdown can be a significant drag on global growth. China contributed 23% of global GDP growth in 2002, with China contributing an additional 38% of world growth in 2019, IHS said. The People's Bank of China (PBOC) publicized strategies to carry out RMB 1.2 tn $173 billion reverse repurchase operations to ensure an adequate supply of liquidity to the economy. The current liquidity in the banking system is RMB 900 billion $129 billion more than the one registered in the previous year during the same time. China is also expected to announce tariff reductions on essential goods imported from major countries like the US, in order to ensure supplies despite the recent trade war between the two countries. Non-fiscal measures. The Chinese Trade Ministry ensures that adequate stocks of beef, pork and other essential food items are maintained in order to avoid shortages. Amid preventive safety measures by some of the biggest and busiest international airports to prevent coronavirus from spreading after its outbreak in Wuhan, China, many others took similar action. The coronavirus spread to 25 more countries in a month, prompting border closures, and a number of countries declared health emergencies. CDC response to counter this public health issue. The federal government works closely with state, local, tribal, and territorial partners, as well as public health agencies. The approach to public health is multi-layered, with the goal of identifying and mitigating introductions of this virus in the United States to reduce the spread and effects of this virus. On the 7th of January 2020, CDC developed a COVID-19 incident management program. CDC activated its Emergency Operations Center on January 21, 2020 to help provide continued support for the COVID-19 response. CDC released revised health advice for China on January 27, 2020, recommending that travelers avoid all non-essential travel to all of the country Level 3 health notice. The U.S. government has taken unprecedented travel measures in response to the growing threat posed by this emerging coronavirus to public health. Effective February 2, 2020 at 5 p.m., the U.S. government has prohibited the entry of foreign nationals who have been in China for the past 14 days. U.S. citizens, visitors and their immediate family members who have been to Hubei province and other areas of mainland China are permitted to enter the U.S., but are subject to health monitoring and potential quarantine for up to 14 days. On the 1st of February 2020, the CDC released an Interim Health Alert Network (HAN) update to notify state and local health departments and health professionals about this outbreak. On January 30, 2020, CDC released guidelines on the clinical care of COVID-19 patients for healthcare professionals. CDC released guidelines on February 3, 2020 to determine the potential risk for different exposures to COVID-19 and to treat those people appropriately. CDC has sent multidisciplinary teams to Oregon, Illinois, California, Arizona and Wisconsin to support hospital care, information finding, and outreach divisions of safety. CDC developed a real-time reverse transcription polymerase chain reaction (RRT-PCR) test that can diagnose COVID-19 from clinical specimens in both respiratory and serum samples. CDC publicly posted the assay protocol for that study on January 24, 2020. The CDC sent to the United States an Emergency Use Authorization (EUA) kit, Food and Drugs Administration, for their check on the 3rd of February 2020. On the 4th of February 2020, the FDA approved the EUA. On February 5, 2020, CDC test kits were available to order through the agency's International Reagent Service external symbol from domestic and international partners. When sequencing was done, CDC submitted the entire genome of the viruses from reported cases in the United States to GenBank. CDC has developed the COVID-19 virus in cell culture that is required for additional studies, including further genetic characterization. The cell-grown virus has been sent to the NIH-BEI tool symbol for the large scientific community to use. Travelers from China arriving in the United States. CDC is collaborating with public health agencies to implement new travel protocols reported in a presidential proclamation on novel coronavirus to slow the spread of 2019 novel coronavirus into the United States. We'll summarize. 1. Foreign nationals visiting China in the past 14 days are not allowed to enter the United States. 2. American citizens, lawful permanent residents, and their families who have been in China for the last 14 days will be allowed to enter the United States, but will be diverted to one of 11 airports to undergo health screening. We will have some form of limits on their movements for 14 days, depending on their safety and travel background, from the time they leave China. If you are in the second group above and are flying to the US, your travel will be diverted to one of 11 US airports where CDC has quarantine stations. We'll ask you about your health and your work. Your well-being is checked for fatigue, cough, or breathing difficulties. Based on your safety and travel history, for a cycle of 14 days from the time you exited China, you will have certain limits on your movement. Such measures are being taken to protect your safety, other travelers, health, and the health of U.S. communities from the current coronavirus that is spreading from person to person in parts of China. Travelers who have been in Hubei province for the past 14 days, if you have fever, cough, or breathing problems, you will be checked for illness by CDC workers at the airport. They will drive you to a medical facility for further examination and care. Your travel itinerary won't be complete. If you have no symptoms, fever, cough, breathing problems, you will be put under a federal, state, or local quarantine order for a maximum of 14 days from the time you left China. You might not have the chance to complete your travel itinerary until the time of 14 days is finished. Travelers from other parts of China outside the province of Hubei in the last 14 days, if you have fever, cough, or breathing problems, CDC workers at the airport will test you for illness. They will drive you to a medical facility for further examination and care. Your travel itinerary may not be complete. If you have no symptoms, you will reach your final destination. When you arrive at your final destination, you are asked to monitor your health for 14 days from the time you left China. You will receive a health information card telling you what symptoms to watch for and what to do if symptoms arise. You will stay home during that time and restrict as much contact with others as possible. You will be contacted by the state or local health department for further follow-up. Interim considerations for disposition of hospitalized patients with COVID-19 infection. There is currently limited information available to describe the scope of clinical illness, the efficiency of transmission, and the length of the COVID-19 infection viral shedding. On the basis of available COVID-19 knowledge and what is known about associated coronaviruses, MERS-CoV and SARS-CoV, interim guidance for the disposition of hospitalized patients with COVID-19 infection was established. When new information becomes available, this advice is subject to change. The following attempts to act as a guide for the treatment of patients. All patients should be handled on a case-by-case basis and addressed with health care providers and public health agencies about their attitude. For hospitalized patients with confirmed COVID-19 infection, Usually, in an airborne infection isolation room (AIIR), hospitalized patients with confirmed COVID-19 infection should be managed using normal, contact, and airborne precautions with eye protection. If no immediate AIIR is available, consideration should be given to moving the patient to an AIIR facility. The patient should be cared for in a single-person room and the door should be kept closed if relocation is necessary or not medically acceptable. Ideally, the space should have no exhaust, which is recirculated within the building without filtration of high-efficiency particulate matter (HEPA). Healthcare staff should still use boots, mask, breathing and eye protection and follow all other approved procedures in the prevention and control of infections when caring for these patients. If there are inadequate AIIRs for patients with reported COVID-19 infection, prioritization should be provided to existing AIIRs for patients with symptoms of severe illness, e.g., people needing ventilator assistance. The decision to discontinue transmission-based precautions for COVID-19 hospitalized patients should be taken on a case-by-case basis in conjunction with physicians, infection prevention and control professionals and public health officials and should consider the seriousness of disease, the signs and symptoms of disease and the findings of the COVID-19 laboratory test in respiratory specimens. Considerations to discontinue transmission-based precautions include meeting all the following: relief of fever, without use of antipyretic medication or improvement of disease signs and symptoms, negative results of COVID-19 RT-PCR examination from at least 2 consecutive respiratory tracts, nasopharyngeal swab and throat swab specimens obtained within 24 hours *. For 2019 novel coronavirus COVID-19, see interim guidelines for the selection, treatment, and testing of clinical specimens from persons under investigation, PUIs. As more information becomes available, initial guidance is based on limited knowledge and is subject to change. In persons with chronic active cough, sputum specimens may detect COVID-19 RNA for longer periods than the upper respiratory tract specimens, nasopharyngeal swab and throat swab. For non-hospitalized patients with confirmed COVID